Welcome to Complete Conversations. And just a quick note, we're AI hosts powered by Google AI. It's Men's Mental Health Month. So today we're diving into it.
And it's something we don't talk about enough, I think,
Yep.
taking care of your mind.
Why is this such a big deal then? Let's unpack some of the challenges, these invisible walls that society kind of builds up. There's still so much pressure on men to hide feelings, right? To not show weakness. And that often means guys feel like they have to handle everything alone. They can't really talk about feeling anxious or depressed.
Exactly. That pressure is a huge barrier. And instead of reaching out, sometimes men turn to, well, risky ways of coping. Things like drinking too much, maybe drugs, or even just getting angry a lot. But those things, they don't actually fix the problem. They often just mask it or make things worse down the line. And what's concerning is that men are just less likely than women to go see a doctor or a therapist, which means conditions like depression, anxiety, they often just go unnoticed, untreated.
And that leads to something really serious, something we have to talk about. The suicide statistics are just stark. According to the CDC, men die by suicide about 4 times more often than women. 4 times. It really highlights how critical it is to get help for untreated depression and stress.
If these struggles are common, how do we change the story? How do we shift things? The truth is, and this is so important, talking about it, getting support, that's strength. It is absolutely not weakness.
Right. Strength. So how does this play out at home for your family? Well, think about it. Kids learn by watching us, don't they? If they see you dealing with stress by talking to someone or finding healthy outlets, guess what? They learn to do the same.
Exactly. They pick up those habits. And connecting that to the bigger picture, a happier dad often means a happier home. It just does. When you get help, when you start feeling better, you've got more patience, you can be more present with your partner, with your kids. It really can break unhealthy cycles. It teaches kids it's okay to have feelings and it's okay to talk about them. Like saying, hey, dad's feeling a bit sad today, but I'm working on it.
Okay, so what practical steps can someone take, like right now?
Okay, first step, talk about it. Find someone you trust. A friend, family, maybe someone at church, a coworker. Doesn't have to be a big speech. Just something simple like, man, I've been really stressed, or I just don't feel like myself lately.
Starting the conversation. Yeah. What's next?
Second, see a healthcare provider. Make that appointment for a checkup. Our Williamstown location at 711 Marcia Avenue has great services for men. And not only men, but it also has services for your whole family. Healthcare providers, counselors, and more. You can call them at 856-451-4700. And, we have 19 different sites across Cumberland, Gloucester, and Cape May counties. Call and find a location near you.
And the third step?
Third, and this is critical, get help in a crisis. If you ever feel like hurting yourself or someone else, please get help immediately. Call or text 988. That's the Suicide and Crisis Lifeline. It's free, confidential, always available. And just remember, asking for help isn't admitting defeat. Not at all. It means you're taking charge of your health. And that helps you, and it helps your whole family. Taking care of your mental health, that's showing strength, is protecting the people you love.
So here's a final thought for you to chew on after this deep dive. What's one small step, maybe even a tiny one, you could take this week just to check in with yourself? Or maybe encourage a man in your life to do the same. Remember, your health, your whole health is truly a gift to your family. And we're here for you. For more support, more info about services, get in touch with us at CompleteCare Health Network. The number again is 856-451-4700. Or shoot us an email, CompleteConversations@chcinj.org. That's all for this deep dive. Thanks for tuning in to Complete Conversations. Until next time, stay well.